This is Medical Surgical Nursing, Diabetes Mellitus, presented by Section 314, Group Number 1. Once upon a time, a child is studying her lectures as well as her notes, when suddenly she felt weak, tired, and had a blurry vision. With that, she calls her mom about this matter. Her mother answers, "Yes, darling, what's wrong?" The child says, "I'm having a hard time focusing on my lectures. My eyes get blurry, and I always feel weak. Most of the times, I am hungry and thirsty. I hate it. I really hate this feeling. It affects my study habits. See, I already lost a lot of weight. I don't know what's happening to me." The mother answers, "Really, baby? I didn't know you are experiencing that. Let's go to the doctor so that we know what's happening." At the doctor's office, the doctor says, "Ma'am, it seems like your daughter's manifesting the signs and symptoms of type 1 diabetes mellitus, but we need to conduct further tests to confirm her diagnosis." The mother answers, "What? What is type 1 diabetes mellitus? Where did she get that from? Isn't she too young to have that?" Here is Nurse Rai, and she will be explaining what is diabetes mellitus and its types. According to the Centers for Disease Control and Prevention in 2021, diabetes mellitus, simply known as diabetes, is a health condition wherein the pancreas does not produce sufficient insulin to keep the level of glucose in the blood under control. It has three types: type 1 diabetes, type 2 diabetes, and gestational diabetes. Today we will only be discussing type 1 diabetes and type 2 diabetes. In type 1 diabetes, the pancreas does not produce enough insulin or does not provide it at all. The main cause is a genetic disorder where the immune system is destroying the insulin-producing cells of the pancreas. This is often called an early onset disorder because it develops in the earlier stages of life. The risk factors of this condition are the following: family history, a parent, sibling, or a relative who has type 1 diabetes; diseases or injury of the pancreas; inability to make insulin; age, any age but more likely to develop during childhood, teenage years, or young adult; ethnicity, African Americans and Hispanic or Latino Americans are the most vulnerable to this disease. What are the clinical manifestations? Increased thirst, frequent urination, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, and blurred vision. Type 2 diabetes. The most common problem with this kind of diabetes is not due to the insulin not having its supply, it's due to the insulin receptors being blocked by fat molecules. Most individuals who have a sedentary lifestyle have this kind of diabetes. The risk factors for type 2 diabetes are the following: family history, age, physical inactivity or sedentary lifestyle, diagnosed with pre-diabetes, history with gestational diabetes, high blood pressure, obesity or being overweight, and ethnicity. The clinical manifestations include frequent urination, increased thirst, fatigue, tiredness, sudden weight loss, itching around the genitals, slow healing cuts or wounds, and blurred vision. The laboratory and diagnostic tests include glycated hemoglobin A1C test. The A1C test is a blood test that shows the average blood glucose levels over the previous 3 months. Random blood sugar test. When diabetes symptoms are evident and healthcare practitioners do not want to wait until a client has fasted, they may perform the RPG test to diagnose diabetes. Fasting plasma glucose (FPG) test. The fasting plasma glucose or FPG blood test takes a single reading of the client's blood glucose level. The nursing diagnoses are ineffective tissue perfusion related to the high concentration of glucose in the blood as evidenced by glucose levels above by the normal range. Deficient knowledge related to personal medication as evidenced by misinterpretation of client. Risk for unstable blood sugar level related to insulin resistance. Nursing interventions. Educate about home glucose monitoring. Review factors in glucose instability. Encourage the client to read labels. Discuss how the client's anti-diabetic medications work. Check the viability of insulin. Review type of insulin needed. Check injection sites periodically. What are the medical managements? For type 1 diabetes mellitus, the most effective are diet, activity, and exercise. Insulin, always a component in the management. For type 2 diabetes mellitus, the most effective are diet, activity and exercise, oral hypoglycemic agents or injectable hypoglycemic agents, insulin in case of stress, surgery, infections, and pregnancy. For type 1 diabetes mellitus, the complications are heart and blood vessel disease, nerve damage, kidney damage, eye damage, foot damage, skin and mouth conditions, bacterial and fungal infections, gum disease and dry mouth, pregnancy complications. If left untreated, this can progress to atherosclerosis, stroke, eye and kidney disease. The complications for type 2 diabetes mellitus are infection, foot problems, cognitive problems, increase the risk of Alzheimer's disease. If left untreated, this can progress to loss of vision, kidney failure, lower limb amputation. Here are the references for this presentation. Thank you.